Here at Bergen Oral and Maxillofacial Surgery, our goal is to provide you with the highest quality of care and to return you to your normal routine as quickly as possible. Now that your surgery is complete, it is important that you follow these post-operative instructions closely to minimize swelling and discomfort. Please avoid spitting, sucking through a straw, or smoking the week following surgery. Stay away from crunchy or spicy foods for 2 weeks and avoid touching the wounds or sutures as much as possible. The day of surgery, cold, creamy foods are recommended, as well as cold compresses for 2 to 3 days following surgery. Make sure to stay well hydrated and rinse with warm salt water for 1 to 2 weeks, beginning the day after surgery. A certain amount of bleeding is normal after your surgery. To help control the bleeding, gently rinse the area and then bite firmly on a gauze pad for 30 minutes. If bleeding persists, repeat the same process with a moistened tea bag. Following your procedure, you will experience some swelling proportional to your surgery. For the first 36 hours, you can relieve some of this swelling by placing a plastic bag filled with crushed ice to the side of the face where the surgery was performed for 20 minutes and then taking it off for 20 minutes. You can repeat this continuously while you're awake. It's normal for swelling to reach its maximum 2 to 5 days following surgery. On the 4th and 5th days, you can find relief by applying heat, chewing gum for 15 minutes, or doing gentle stretching exercises. It's very important that you avoid rinsing or brushing your teeth for 24 hours after surgery. After 24 hours has passed, rinse your mouth gently with warm salt water after each meal and at bedtime. You may gently brush your teeth, but avoid the site of surgery. Make sure to drink lots of fluids and continue eating soft foods after your surgery. You will feel better, heal faster, and have more strength if you continue to eat and stay well hydrated. Following your procedure, it's not unusual to see a slight rise in temperature, a sore throat, and some stiffness in the jaw muscles. These normally resolve in time. If sutures are required, they will be removed approximately 1 to 2 weeks after surgery. This is a pain-free process and only takes a minute or so. Drink plenty of fluids. Avoid hot liquids or food. Soft food and liquids can be eaten on the day of surgery. Return to a normal diet as soon as possible unless otherwise directed. You should begin taking pain medication as soon as you feel the local anesthetic wearing off. If a prescription for pain medication was written, please take as directed and pay careful attention to all warnings. For moderate pain, 1 to 2 Tylenol or extra strength Tylenol may be taken every 3 to 4 hours. Advil or Motrin may be taken instead of Tylenol. Ibuprofen, bought over the counter, comes in 200 milligram tablets. 2 to 3 tablets may be taken every 3 to 4 hours as needed for pain. Do not take any of the above medication if you are allergic or if you have been instructed by your doctor not to take it. Be sure to take the prescribed antibiotics as directed to help prevent infection. Good oral hygiene is essential to good healing. Warm saltwater rinses can be made by mixing 1 teaspoon of salt in a cup of warm water. These rinses should be used at least 4 to 5 times a day, especially after meals. There will occasionally be a metal healing abutment protruding through the gum tissue. Brushing your teeth with the healing abutments is not a problem. Be gentle initially when brushing the surgical areas. Keep physical activities to a minimum immediately following surgery. If you are considering exercise, throbbing or bleeding may occur. If this occurs, you should discontinue exercising. Keep in mind that you are probably not taking normal nourishment. This may weaken you and further limit your ability to exercise. Partial dentures, flippers, or full dentures should not be used immediately after surgery and for at least 10 days unless directed by your doctor. This was discussed in the preoperative consultation. If you have questions about your recovery process, please feel free to contact our office and we will be happy to assist you.